Hello everyone, this is Marika and I welcome you all to this new session of Nursing Management with me. In our previous sessions, we have been discussing many interesting topics where we have discussed about job description and the categories of nursing professionals, wherein we have seen what are the different categories that are given to nursing professional in the hospital as well as in education sector. And we have also discussed about the roles and responsibilities that are carried out by each of those nursing professionals. Now, in this session today, we are going to discuss another interesting topic, which is patient classification system. From the term itself, patient classification system, we can understand that it is a certain system that is used to classify the patient. PCS or patient classification system is also called as client classification system. So in this session today, we are going to discuss what is PCS in detail and what is the importance of PCS, as well as what are the several purposes of PCS. A patient classification system, it is a method of grouping the patients who are admitted in the hospital according to the amount as well as the complexity of the nursing care that is required by the patient. Now, we already know that there are several different patients in the hospital and every patient have different healthcare needs, and therefore the nursing care that is rendered to each and every patient within the same ward as well is different from one patient to another. Now, in patient classification system, we categorize the patient or we group the patient in different groups according to the amount of nursing care each of the patient need and also according to the complexity of nursing care that is required by the patients. So why do you think that patient classification system is required? Patient classification system will help to distribute the workload appropriately among all the staffs within the organization. Not only the workload requirement, but it also helps to identify the staffing need as well as working hours for each of the staff in the hospital. So once we know that what kind of care is required by different patients in the hospital and the amount of time that is to be invested to provide care to those patients, it is easy to divide or distribute the work among the staff. It helps to understand where more number of staffs are required and also which sector requires more number of staff. All of these things can be identified through patient classification system. Patient classification system is also a tool which helps us to measure the nursing needs of the patient. The patient classification system also helps us to understand the nursing needs of the patient. It also helps to analyze the nursing interventions that are required in order to meet the needs of the patient as well as the skill that is required for the nurses to meet those needs. Patient classification system, all in all, is a system of grouping the patient into a certain category according to the amount and the complexity of nursing care that is required by them. Now, this helps not only classifying the patient, it also helps in staffing, it helps to distribute the workload and also to understand the deficiency of the staff in each of the sector. This will also help us to understand the nursing need of the patient. It will help us to analyze the nursing intervention that is required, as well as it helps us to understand the skill that a nurse must possess in order to meet those needs. So one of the very important things that we should understand in patient classification system is that mostly all the classification or all the categories are divided according to the dependency of the patient on the caregiver and also the amount of time that the caregiver has to invest to meet those needs. So in patient classification system, the classification majorly is based on how much time is required to provide the particular need to the patient as well as the dependency of the patient on the nurses. So I hope you've understood what is patient classification system. Next, we are moving on to the importance of patient classification system. Now, why is it necessary for us to have a category, or why is it necessary to categorize the patients? So there are several importance of patient classification system, which includes improved patient satisfaction. So the very first importance of PCS is improved patient satisfaction. Now, how does categorizing the patient into different groups provides an improved sense of satisfaction to the patient. So we have already learned that when we categorize the patient into different groups, we see how much is the patient dependent on the nurses and what is the amount of time that a nurse has to invest to meet the needs of the patient. So when we are classifying the patient, we are seeing how much time does a nurse has to invest to provide the care to the patient, and the required time in order to fulfill those needs are provided to each of the patient under patient classification system. When the required amount of time is provided to the patient by the nurses, then the sense of satisfaction among the patient is increased. Another important thing is also improving a sense of satisfaction among the staffs working within the hospital. We have already seen that patient classification system helps us to understand the workload, to distribute the workload, and also to understand the skill that is required in order to deliver those nursing needs. It improves the satisfaction of the nurses because the workload is divided equally among the nurses because of the patient classification system, and also the staffing needs within the hospital is identified through the patient classification system. So the nursing head will be able to identify where more number of nurses are required within the hospital to provide the proper care to the patient. Now, when workload is properly divided, when staffing needs of the hospital are identified and the required nurses are recruited in the particular area, it helps to enhance the staff satisfaction as well. The next importance of patient classification system is to monitor the quality of nursing care being rendered. Now, this is one of the most importance of patient classification system. Now, we classify the patient according to the need of the patient, the amount of time that each of the healthcare professional may have to invest in the patient to meet the needs of those patients. So with a proper patient classification system, the administration or the nursing head will be able to monitor the quality of nursing care being rendered. So these are the few importance of patient classification system. Moving on, we are going to discuss the purposes of patient classification system. So the very first purpose of patient classification system is to provide safe and quality standardized nursing care to the patient. The second purpose of patient classification system is to determine the number as well as the category of staffs that are required to meet the nursing needs of each and every patient within the hospital. So we know that there are different patients who come to the hospital with different healthcare needs and different nursing needs. So therefore, different number of staffs as well as staffs having different skills are required in order to fulfill the needs of the patients. Another very important purpose of patient classification system is to provide data on each of the patient's unit so that it helps the management or the administration of the hospital to make proper decisions. Another important purpose of patient classification system is also to assess the level of services that are required. It helps us to understand what are the different kind of services that are required within the hospital. The next purpose of patient classification system is to enhance staff satisfaction. This we have also discussed in the importance, where we have seen that staff satisfaction can be enhanced through patient classification system because it helps us to distribute the workload equally among the staff. It helps us to understand what kind of skill is required. It also helps to determine the skill that a nurse must possess in order to carry out the activity. Therefore, distribution of workload, the number of staffs that are required. So all of these things will help to enhance the staff satisfaction. Another important purposes of patient classification system is to categorize the patients in different groups according to the time, the skill, and the needs of the patient. And the last purpose of patient classification system, as we have discussed, is to determine the workload as well as to determine the nursing care requirements of the patients. So these are the various purposes of patient classification system. I hope you've understood today's topic. We have discussed a very short and a very interesting topic where we have seen what is patient classification system, what are the several purposes of patient classification system, and the importance of patient classification system. In our next session, we will be discussing about the different types of patient classification system and how a patient categorized into different groups. I hope the class was helpful, and I'll see you all in the next session. Thank you and have a great day ahead.